I'm Renee. I'm Dr. Gazelli's physician assistant and second pair of hands during surgery. You are getting ready to have a posterior lumbar decompression and stabilization. Today I'm going to walk you through the procedure and recovery time from start to finish. Please feel free to take notes. I'm happy to go over any questions that you have or go over any more detail with you face to face. This is not meant to be comprehensive, so I do expect you'll have questions, but hopefully it gives you a good amount of information about the procedure, the day of surgery, and the recovery period. So on the day of surgery, you'll be arriving at either Rose Medical Center or Cherry Creek Surgery Center. You will come 2 hours prior to the procedure at Rose Medical Center and an hour and a half prior to the procedure at Cherry Creek Surgery Center. We operate at both of these facilities regularly, so there are anesthesiologists and surgical teams that we do work with on a regular basis. So in the beginning, you'll be brought back into the pre-op holding area, and the nurses there will start an IV and get things prepped and ready. They will make sure that all current medications, all medical history, everything is updated in the computer. You will see the anesthesiologist in the pre-op holding area, and sometimes they even call you the day before surgery. So if you get a call from a number you don't recognize that day before surgery, you may want to answer it because it could be that anesthesiologist calling you to get to know you a bit and chat with you. You of course will see Dr. Gazelli in the pre-op holding area as well. He's always happy to go over any final questions that you have at that time. As far as the approximate time of the procedure and what your family should expect, typically a one-level decompression and stabilization should take us about an hour or so. And you can add about 30 minutes extra for each additional level of decompression that you are having done if you are having more than one level done. We're always happy to keep your family and friends or whoever's there with you informed and up to date during the procedure. The nurses in the operating room can give them calls, and Dr. Gazelli, of course, will call them and come see them after the procedure. If they are in the facility, he's happy to go find them and sit with them face to face and talk to them about the procedure and how things went. If they can't be at the facility, that's okay. He's always happy to call them on the phone and chat with them at that point. As far as what happens in the operating room, you've probably already watched the video on the procedure, so hopefully you've got a good understanding about it, but I'll give you a little bit of a recap here and go over some commonly asked questions that patients have. This procedure is done under general anesthesia. We also have people in there monitoring your nerves during the surgery. So after you're asleep, they're going to put little baby needles all over from head to foot. And those are going to read the nerves and watch the nerves during the surgery. So if something starts acting abnormally, they'll let Dr. Gazelli know right away. So I mention them as well because I want to warn you if you wake up with pinpricks, bruises, or bleeding, that's what that was from. The incision is typically in the middle of your low back and is usually about 1.5 inches to 2 inches or so, maybe a little longer for multiple levels of decompression, but we try to keep it pretty small. Then we will move the muscles aside after we've made the initial incision to get down to the spine and to the bone. We then also bring in a microscope to make sure that both he and I can see everything nice and clear. And then at that point, to perform the decompression, we will remove any bone, ligament, degenerative overgrowth, maybe any disc material, anything that's pressing on the nerve will be removed to make sure that the nerve is floating free and that it's no longer being compressed. Once all of that decompression is done and we're confident that the nerve is freed up and happy, then we'll go ahead and do the stabilization. And at that point, we add in a little bit of a clamp that we put in along with some donor bone graft. And once that is positioned and locked into place, the procedure is done and we'll go ahead and close the incision. The incision is closed with multiple layers of dissolvable stitches, and typically the top layer is dissolvable as well. I'll leave a little loop knot at the top and the bottom of the incision for tension on the wound. If you or somebody sees it, it looks like clear fishing line. We'll also put skin tapes or white steri strips over the incision. And then on top of that will be a gauze bandage as well. You'll then go into the recovery room, and while in the recovery room, the nurses there will monitor you, make sure you're waking up okay. They'll make sure that they can help manage any pain or discomfort that you're having. They'll help you get up and move around and walk before just being discharged home. Sometimes we put a drain in after the surgery, and if that's the case for you, the nurses in the recovery room will watch the drain and monitor that. As long as it's very little drainage, the nurses will pull that drain out before you go home. On occasion, a drain is draining a little bit extra and we're not real comfortable with them pulling it before you go home. But if you're still ready to go home at any point, they can send you home with that drain, and then we would just ask that you come back in the clinic the next day and we will remove it. That doesn't happen very commonly where we send someone home with a drain, but I mention it because it has happened and we have had to do that before. As far as discharging you and getting you home, the nurses again will watch and make sure that once you're awake, pain is relatively controlled, you're getting up and walking and moving okay, they can get you discharged to home. You also will have pain medicine and muscle relaxants for after surgery, and oftentimes I like to give those to you prior to surgery so you can get them filled ahead of time so that nobody needs to worry about getting them filled the day of surgery. So hopefully you already will have those, and those will be taken just as needed. We do give you antibiotics in the surgery or during the surgery, so we do not send you home with antibiotics. It should just be the pain medicines and muscle relaxants that you will have at home. Typically, this procedure is an outpatient procedure and you should go home the same day of surgery. If for some reason you're spending the night at Rose Medical Center, there is a spine and orthopedic floor that you'll stay at, and the nurses and physician assistants there work there regularly with spine and ortho patients, and so they're comfortable taking care of them. The physical therapist and occupational therapist will also work with you while you're there, just for daily living activities, getting in and out of a bed or a chair, and basic walking around. Typically you're in a gown most of the time that you're in the hospital, but you're welcome to bring any comfortable loose fit clothing to wear, or at least to go home in when you do go home. You're also welcome to bring in any toiletries or things like that you would like to from home. And all rooms at Rose Medical Center are private, so you will not be sharing a room with any other patients. While you're there, you will be seeing Dr. Gazzelli or myself on a daily basis. And if you're there over a weekend, you'll also see Dr. Gazzelli or myself or one of our other surgeons or physician assistants who happen to be on call that weekend and are taking care of and rounding on all of our inpatients. As far as what to expect initially after the surgery and restrictions that we place on you, typically we have you use walking as your main activity and exercise or therapy the first 6 weeks after the surgery. So I do want you moving and walking pretty quickly. You will be up and moving the day of surgery. I don't want you bedridden or chair-ridden at all. So if you're at home just watching TV, hanging out reading or something like that, please make sure that you're getting up every 45 minutes or hour to walk around the house, get a drink of water, go to the bathroom, just move around a little bit. If it's nice outside, please feel free to take little walks outside as well. And initially it should just be multiple little walks throughout the day. As you're feeling more comfortable, you're welcome to increase that to fewer longer walks as whatever your comfort level is. But again, that first 6 weeks walking is your main form of exercise and therapy. We also ask that you not do any bending, twisting, or lifting more than about 10 pounds. We'll keep that restriction again for the first 6 weeks. We also will have you wearing a brace after this with the stabilization. So the rule of thumb with that brace is that you'll wear it anytime you're out of bed longer than about 5 to 10 minutes. So you don't need to sleep in it, you don't need to lay down in it. If you're getting up in the middle of the night to go to the bathroom and straight back to bed, you don't have to put it on. But once you're up for the day, whether you're sitting, standing, walking around, you will have it on. So it's like a nice corset that helps remind you not to do certain physical activities, as well as gives you a bit of stabilization after the surgery. You also will have white Ted hose or stockings on your lower legs and feet when you get out of surgery. You can go home with those. Typically we don't require you to wear them at all times unless you're not getting up and moving enough, or if you're having some swelling in the lower legs or ankles, then you probably should wear them. But otherwise you shouldn't need to wear them after surgery. As far as showering and wound care, the incision again has steri strips and typically that dissolvable stitch. All of that can get wet in the shower starting the second day after surgery, or about 48 hours after surgery. So what I usually have people do is you'll take that outer gauze bandage off and shower like normal, letting the soapy water trickle down your back. Just don't let the water pound on the incision, don't scrub on it, and don't soak it in a pool or a bathtub. Once you're done with the shower, feel free to pat it dry and put a new dry gauze bandage. There's no need for any ointments, lotions, creams, or anything like that on the incision, so just keep it clean and dry. As far as with the medications that we send you with, and with the pain medicines especially, sometimes those can kind of slow down the belly and cause some constipation. So we typically recommend that you use stool softeners regularly for as long as you're on a pain medication. And of course, step it up to laxatives if the stool softeners are not enough for you. If you cross over to the opposite and start having diarrhea, then please stop the stool softeners or any laxatives. And with driving, we ask that you not drive as the driver for up to the first week after surgery. And a lot of that has to do with the anesthesia, stronger medicines you were given during surgery. And if you're taking pain medicines at home during the day, you really shouldn't be behind the wheel. Typically, once we see you back for your first post-op, at that point, for sure, we should be able to clear you as long as you're not taking those pain medicines regularly during the day. You can ride as the passenger anytime you want to, or if you're taking a short drive somewhere. With work, we usually recommend if you have an office type or sedentary type job, you're welcome to get back within that first week, or for sure 2 weeks after surgery. Typically, when you do go back to work, we do recommend that if you have the capability of going back part days, then that's usually best for you, because typically you'll get very wiped out or tired after this surgery and after general anesthesia. And so going back for a full 8 to 10 hour day right away is often too much for you. So if you have that capability of going back part days initially, maybe the first week back at work, that's usually beneficial for patients. You are welcome to work from home if you have that capability at any point, whenever you're feeling up to it. For those of you who have more physically demanding jobs, like construction workers or anything more physical, you're usually going to be out of work longer, unfortunately, because we need to restrict your physical activities for 6 weeks and then start physical therapy to get you strong again and cleared to do those physical activities. It can take 2 to 3 months for us to clear you to full duty on a more physically demanding job. As far as complications, we like to talk about, of course, you'll anticipate incisional pain from the incision itself and the muscle work that we do back there. So you'll have that back discomfort or pain getting better over time, but there may be some level of it within that first 4 to 6 weeks as the soft tissues are healing, and until we really get things strengthened back up after that 6-week mark and when you start physical therapy. But hopefully it's not severe pain, and again, it will ease up over time. Any persistent nerve symptoms, weakness, pain, tingling, numbness, it's normal to still have some of that after surgery. Our hope typically is that you'll wake up and have much less pain or less symptoms. It's okay to have less frequent, less severe symptoms than what you had prior to surgery. That's normally what we expect. On occasion, a patient will wake up with almost complete resolution or resolution of symptoms, and that's excellent. But I also warn people, it's okay if it's just that it's not completely resolved, but that you have less severe or less frequent symptoms. That's what we would typically anticipate. And then it just takes some time for the nerves to heal, and that's why you still have some symptoms residual until the nerves completely heal. They do like to heal slowly, so sometimes it's a little bit of a slow process. Now, on occasion, though, a nerve can get aggravated that we were in there and operating around it. And so sometimes a patient will wake up with the same level of nerve symptoms or increased nerve symptoms, whether it be pain, numbness, tingling, weakness, whatever the case may be. That is a pretty rare occurrence for a patient, but it can happen, so I mention it to people. And if it happens, we'll use some medicines to calm down that inflammation and irritation of the nerve. The other thing that I like to mention is the dural tear. The dura is the sac that holds the spinal fluid and the spinal nerves. It's a thin membrane. Sometimes a sharp piece of bone or an instrument could put a hole in it. And if that happens, we'll see the spinal fluid leak. So we'll sew it up right then and there and put a little gel over it to seal it. Typically, it does heal up on its own without any long-term effect to you, but we oftentimes will make you lie flat for a couple of hours up to overnight, depending on the extent of the tear. So typically, again, you should go home that same day, but it might be a couple hours later than you anticipated, or potentially we make you spend the night if we feel we want you to lie flat all night. The other difference with that is that if we do have that dural tear, instead of the dissolvable stitch at the very top layer and the steri strips, I will use an outside stitch. So it's just a different stitch for us to take out at your first post-op visit. You take care of it just the same way I've already described. As far as infections go, usually there's a very low chance of infection with these wounds. Diabetic patients can be at higher risk, but again, we still have a low infection rate or possibility of infection. The other thing with the stabilization and the instrumentation that we're putting in there, there's always the chance that that stabilization doesn't fully take or do what we want it to do. That little bit of bone graft that we put in there doesn't knit together and stabilize that level, causing it to just not remain as stable as we wanted it to be. Or sometimes the spinous process, which is the bones that this clamp is clamped onto, can fracture. So there's always those hardware failure or bone growth failures that could potentially happen. Not something we commonly see again, but it can happen, so we mention it. As far as when to call us after surgery, any changes in strength as far as increasing weakness, worsening strength, things of that nature we want to know about, so please call us and let us know. Any increasing symptoms, pain especially, tingling, numbness, things that are getting worse. As I mentioned previously, it's normal to still have some symptoms as long as it's much better than it was before surgery or kind of comes and goes. Even you may have some days that are better than others, and that's normal. So as long as overall it's improving, but it just is kind of up and down a little bit, that's okay as far as your symptoms go. But if you're having escalating symptoms of pain, numbness, tingling, weakness, those types of nerve symptoms, we want to know about that. Any persistent fever or other signs of infection in the wound as far as increased redness, swelling, new drainage, anything like that, please let us know. And same thing, persistent nausea or vomiting, also let us know. We're happy to use some medications to help with that as well. And when you'll see us next is typically that first post-op visit, which is about 7 to 10 days after surgery. At that visit, we will remove any sutures or steri strips that are there. We will get x-rays at that visit and review those with you. We will answer any questions that you have, overall review how you're doing, refill medications if necessary. And as I said before, typically after that first post-op appointment, we are able to clear you to drive as long as you're not taking the narcotic or pain medications during the day. We will then see you at your 6-week post-op visit, at which time we'll wean out of the brace and start physical therapy. And because there's a stabilization and instrumentation in there, we like to also see you at a 6-month post-op and a 1-year post-op. We do get x-rays at every visit to monitor that instrumentation and that stabilization as well. And getting you back to normal. At that 6-week post-op visit, we will start you in physical therapy for core strengthening and stabilization, and we will give you an order for that to give to the therapist. We'll also start having you wean out of the brace altogether after that appointment. And in conjunction with the physical therapy, you'll start increasing your normal activities. You'll increase your bending, twisting, and lifting, keeping in mind proper body mechanics still when you're doing those motions, but slowly and gradually increasing activities as you're working with physical therapy. And the physical therapist can help guide you as well as far as getting you back into any workout program that you like to do, sports, physical activities, whatever it is you enjoy doing. So hopefully this video has given you a good amount of information about the procedure, the day of surgery, and the recovery period. But please feel free to call us at any time if you have any questions or concerns. Thank you.